of Indiana County, WCCS 101.1 FM, AM 1160, and WCCSradio.com. And in the studio with me this morning from the Indiana Regional Medical Center, Dr. James Ianazzi, who is a behavioral neurologist, and Wade Evans, CRNP. Gentlemen, good morning to both of you.
Good morning.
It's good to have you both with us here today. Our conversation is brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. Now, May, and we're still in the month of May, May is Stroke Awareness Month, and so you guys are perfect for us to talk about as we head into the month of June. As we say goodbye to the month of May, we don't want to forget about the possibilities of strokes. And stroke awareness is something we all need to pay a lot of attention to. So let's do that. Dr. Ianazzi, stroke in the month of May, there's no significance to the fact that Stroke Awareness Month is May. Stroke can occur at any time, right? We don't have
exactly, right.
It's not a heat-related type of thing or anything like that.
No, I mean, I'm sure the experts might say, okay, if you connect this to that, maybe people overexerting themselves and therefore raising their blood pressure, etc. But for the most part, you're correct. Stroke can occur at any time.
Yeah. All right. So there are some bellwether things, some things that we take note of. One is the Be Fast acronym. Used just to be fast, didn't it?
That's right. Yes.
Yeah. So, but now it's Be Fast.
Yeah.
What's the difference?
So the letters stand for, the B is for balance. So these are, symptoms to be aware of and that could indicate a stroke. So the B is for balance. If someone suddenly seems to be very off balance, and I just said the word suddenly. So for stroke, usually it is going to be an abrupt, sudden change in the person. And so balance, if they suddenly seem off balance, that could be due to leg weakness or balance from other issues, but sometimes the loss of balance is due to leg weakness. The E stands for eyes, so a person suddenly describing a change in their vision, or if their eyes suddenly look different, if it seems as though one eye is suddenly malpositioned, one eye is deviated to one side, that a moment earlier was not the case, that could also be related to eyes. The F in Be Fast stands for face. So typically you might see a facial droop, and the lower face would droop on one side. With a stroke, it's only the lower face. If it's the entire face that's drooping, that typically would not be abrupt. That would typically be what's called Bell's palsy. But when someone comes in to the ER with face weakness, that's typically they're trying to figure out, is it stroke or is it Bell's palsy? That's a separate issue. But facial weakness, especially in the lower face that's abrupt, could be a sign of a stroke. So BEFA would be arm. So just like we spoke about, imbalance possibly be doing to abrupt leg weakness. If there's abrupt arm weakness, the arm suddenly falls to the person's side, or they drop something, or they just say, my arm suddenly feels weak, even if it doesn't look weak. If it feels to them that if it's weak, it could be a sign of a stroke. BEFAS, so speech. If the person suddenly has slurred speech, or we're encompassing language in with the F. So speech would really be slurred speech, typically, if it's an abrupt change in the sound of their character of their speech. But language also, if they suddenly are speaking gibberish, so to speak, they're suddenly saying things that don't make sense, or they're uttering noises that aren't words, or in the other direction, they suddenly can't understand what's being said to them. They might seem as if you're suddenly speaking a foreign language when you're still speaking English. That is encompassed under speech. And then the T in Be Fast is time, which really refers to time to call an ambulance, time to get yourself to the ER. Time is brain, and the longer you delay getting evaluated, the longer you delay getting appropriate treatment, and the worse the stroke could be if it's a stroke.
Yeah. All right. Wade, let's develop that last part a little bit. Time is brain. Expand that, if you would.
Yeah, meaning there can be medicines we can implement in the emergency department if patients come in soon enough. So meaning we want you to come into the emergency room. Via and activating emergency medical services such as 911, we don't want you waiting at home, developing these symptoms, waiting at home for things to get worse or better. We want you to come in and be evaluated if you're showing signs like we just discussed. As well, people have better outcomes the sooner they come and the quicker they get assessment. If they have a large stroke and are sitting at home, their brain is not getting enough oxygen in certain areas due to the stroke, and have worse outcomes because you have this prolonged time where we're not intervening.
So that being the case, and I remember when Dr. Sada was here, he said, we never mind if you come into the ER if you think that you're having a stroke. It's really important to get there, isn't it?
Mm-hmm. Absolutely.
Yeah. All right. So time is brain indeed. And you mentioned a major stroke as opposed to a stroke that is not as big, if you will. Excuse me. The word mini stroke is out there, and we hear that term a lot. So-and-so had a mini stroke. What is that?
So we're trying to get away from the term mini stroke, meaning if it's a small stroke, there might be certain terms like lacunar to describe these types of smaller types of infarcts. But we're starting to get away from the term mini stroke because I think it's being associated with something called TIA, a transient ischemic attack, which is different than a stroke, meaning you have these symptoms of a stroke, but they resolve on their own in a certain amount of time, but you didn't need intervention. So I think it's confusing to people when they say they have a history of mini stroke. Well, did they have a transient ischemic attack, a TIA, meaning the symptoms resolved on their own in a short period of time, or did they have a very, very small stroke? Those are two different types of things. So that's why you'll notice we start to get away from the term mini stroke.
All right, Dr. Ianazzi, let's talk a little bit about prevention of stroke because that's extremely important, obviously. Yep. We don't want to have to go through something like this. If there are ways that we can lessen the chances that we're going to have a stroke, we want to take those steps.
Yes.
So what are some of the things that we should be doing routinely? And is there an age area where you say, okay, you've reached a certain age, therefore you need to take these steps? Or is it just in general?
Well, it is in general. The older you get, the more likely you are to have the problems in question. And the major risk factors for stroke that we try to always address when someone comes into the hospital to be evaluated for a stroke or even a TIA. A lot of times people are hospitalized when they've had a TIA because we can do the workup more efficiently. And those tests that we do, with rare exception, are the same, whether the person has had a stroke or a TIA. And oftentimes the interventions that we put in place are either the same or very similar. But when you discuss prevention, you're talking about the same risk factors that we address, and the big ones are diabetes, high blood pressure, high lipids, which includes the classic high cholesterol, but you can also have high triglycerides, which is not exactly the same thing, but close enough, if you will, and we use the term lipids, or so hyperlipidemia is high lipids, hypertension is high blood pressure, and smoking is a big one. We always try to convince people to quit smoking if they are a smoker and they've had a stroke or a TIA. We don't succeed as often as we'd like because it's a powerful addiction, it's a powerful drug, but sometimes we do succeed, and we always try to get people to quit. And another big stroke risk factor is an abnormal heart rhythm disturbance called atrial fibrillation, or AFib for short. And all these things are evaluated and addressed in the hospital, and in terms of prevention, seeing your primary care provider, having a PCP to begin with, and seeing your PCP, those things are, very often addressed by PCPs. They do screening blood tests, and, they try to get people to convince people to quit smoking. They prescribe medicines if there's appropriate, if they should be on medicines for diabetes or high blood pressure or high lipids. Or the person may describe a spell that they don't really think much of. They might describe a spell to the PCP, who then thinks maybe that was a TIA. Maybe I should get don't necessarily send this person to the ER for a spill that happened a week ago or a month ago, but they might say, I want to get a carotid ultrasound on you. I want to order some blood tests and make sure you've not developed high lipids or diabetes since we last saw each other, that sort of thing.
Somebody who has had a stroke in the past, severe or not, are they more at risk of a stroke?
It is true that one risk factor for stroke is prior history of stroke or TIA. So, yeah, and we try to, although we don't want to sort of freak people out or paint a dark picture, we do try to, we almost want to use fear a little bit to our advantage and to their advantage. We want people to be afraid of stroke and afraid of TIA. You should be. You should be afraid to smoke cigarettes, kind of thing. But having a history of stroke or TIA does increase your risk of it happening again.
Yeah. Wade, when somebody does present and it turns out that they are having a stroke, I'm sure that there are procedural steps that, things that kick in and the team gets working on it right away. What are some of those steps?
Yeah, so at IRMC we are a stroke center, so we have certain features to our care that are regimented. We do screening criteria to see if you'd be a candidate for a medication called TPA that could help break apart a clot. There are certain safety measures to administering such a medication. So we would, again, be regimented, assessing if it would be the appropriate intervention. And that depends on, did the individual wake up with a stroke? Do we know, was it a witness change in events? Do we have a time of onset of those symptoms? But again, very regimented, and how we approach the care as well, certain standards we meet and keep track of as well.
Yeah. And it really is a team thing, isn't it? I mean,
Absolutely.
The whole team kicks in.
Absolutely.
Yeah.
Very much so. It has to be well orchestrated.
Yeah. Dr. James Ianazzi and Wade Evans, CRNP, joining us here this morning on Indiana in the Morning as we talk about stroke awareness. Family members, Dr. I, they should be really on the ball here, especially around people who have had a stroke before. The family is a big part of the whole formula, isn't it?
Yeah, sure. I mean, I presume you refer to the fact that family members are most likely to be the ones around and observing, seeing and hearing what might be the early signs of a stroke. I assume that's what you were kind of referring to.
Absolutely,
Yep.
So all of that is a big part of Stroke Awareness and Stroke Awareness Month. IRMC is a primary stroke center, and certainly something to take advantage of. Get them to the ER if it turns out that it seems they're having a stroke. Let them make that decision. The folks at the ER, they know better than we do. Doctor and Wade, thanks so much for visiting with us this morning.
Our pleasure. Thank you very much for having us.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. Fox News coming at the top of the hour, but we've got a lot to do between now and then. CBS Sports is next. Jake in the newsroom coming up shortly, too.